IOIC is the best, the higher than FIB4, and the API, you find this is the best one. And it means the transient elastography has a reliable tool and for the staging liver fibrosis in hepatitis patient. Liver stiffness could also be used for evaluation of a therapeutic effect by antiviral agent. Let's look at the two patients. We can find after the treatment of antiviral agent, according to the pathological staging, there is no any change from ESHAC 6 to ESHAC 6. But when we look at the pathological examination, you can find the fibrosis was improved, and the improvement reflected in the change of LSM from 17.2 became 8.2. It means the automatic count quantitative data of LSM is better than pathological staging. The fibrosis is improved truly after effective treatment now and could be evaluated by LSM precisely. So for long-term monitor of disease progression and the evaluation of a therapeutic effect, LSM is quite useful. Elastography is also could be used to evaluate the risk of EV breathing. You can find for this patient's evaluation, we can find the LSM and the spleen diameter has a good estimability for EV breathing. So we can perform ultrasound to estimate the spleen size. We can perform a TE for LSM, and then we can predict the possibility of EV breathing. TE also could predict the possibility of post-operative hepatic failure. The study enrolled 247 hepatitis B patients with HCC. They received liver resection, and after operation, we can find this patient, the incidence of post-hepatectomic liver failure is related to the liver stiffness. And for all patients, and you can find the cutoff point is 40 kilopascal. Before and below, above and below this cutoff point, we can notice the incidence of the hepatic failure after the operation is increased. For serious patient, it's 70 kilopascal. So by this method, we can evaluate the possibility of post-operative complication. LSM is helpful to decision-making after hepatectomy for hepatitis B patients. Beyond the TE, AFI is also another useful method, but the use is not as much as TE is acoustic radiation force impulse. When we perform TE, we evaluate the reflex wave. When we perform AFI, we evaluate the deviation of the shearing wave. So we can use the modified transducer, deliver a zero of focus acoustic pulse to measure the tissue elasticity. We measure the magnitude of the tissue displacement in response of the applied force within this RI. And the result by the VTQ of the AFI is very similar with LSM. In Taiwan University, we used to perform the correlation study. We can find the LSM and the VTQ are highly correlated. And the VTQ result is highly correlated with liver collagen content also. When we could detect the elasticity of the RI, and then we could detect the stiffness of the liver tumor, and it will become a useful tool to evaluate the potential pathological diagnosis of a tumor. And in this study, they enrolled some hemangioma patient, FNH patient, HCC, metastasis, and cholangiocarcinoma, and put the RI within the tumor and get the stiffness value of every tumor. They found the elasticity median value of hemangioma, FNH, HCC, metastasis, and cholangiocarcinoma are totally different. And the stiffness difference could be used as the diagnosis, and we can find the p-value is quite low. By this method, we can find in literature studies included 519 liver lesions. We can find the elasticity could also use for the classification of liver lesion, and the malignant liver tumor seem to be hard and with a higher elasticity, and the benign one sometimes could be evaluated to archive the result of the soft one and the lower elasticity. Finally, I have to say the liver fibrosis status is an important diagnostic need, and more and more important. And the non-invasive elastography has been validated clinically for fibrotic staging in addition to liver biopsy. TE, RTE, RV, all these kinds of techniques is most commonly used to measure liver stiffness. The physical principle on which these techniques are based on difference. Some use Schering wave and some use strain tissue elastography, but the transient elastography with the Schering wave detection is more and more important, became the mainstream now. Ultrasound-guided elastography will be the mainstream for quantitative diagnosis of liver parenchyma. The precise localization of RI will increase the technique success and the data reliability. So we have some take-home message about this lecture. The application of elastography technique could identify the severity of liver fibrosis, no doubt. And we could predict the cirrhosis-related complication and the post-operative events. The characterization of focal lesion could be useful now, and we can use the technique to monitor the treatment of liver disease such as the antiviral treatment, and that will be useful in the future. And the lecture was offered by the Asia Pacific Academia of Mini-Invasive Intervention Oncology from Taiwan. And we offer the basic training of ultrasound guidance technique. And we also offer the advanced training of interventional ultrasound and the surgical ultrasound. And I thank you for your attention, and I regard you will enjoy. Thank you very much.
Okay, thank you very much.